Good evening and welcome to the Hope from Home Gala, a virtual event to benefit those affected by the opioid crisis. My name is Alicia House and I'm the Executive Director of the Steve Rummler HOPE Network.
And I'm Sol Ryan, Chairman of the Steve Rummler HOPE Network's Board of Directors. On behalf of the board, staff, and volunteers who work to make this event possible, Alicia and I would like to welcome you here tonight. Though we cannot be physically together, as with past galas, we're grateful to be connecting virtually with you tonight, raising critical funds to fight the opioid crisis and generating hope from home.
We have a full evening planned for you. You will be hearing about our overdose prevention program and some of our staff who have stepped up during these unprecedented times to fulfill on our mission. We will have a Hope from Home segment where we recognize the generosity of our supporters and share what your generous gifts mean to us as an organization and all the good they allow us to do. Later on, we'll be presenting our Volunteer of the Year and Champion of Our Cause awards to two incredible individuals who have made an impact on SRHN and beyond. And we'll close out the evening with a musical performance from special guests, the Goonie Birds.
Hopefully you've had a chance to look through our online auction already. We have a lot of great items, including a stay in Breckenridge, Colorado for all you skiers and snowboarders. If you haven't placed your bids yet, you have until the end of the evening. Bidding is open until 9 p.m. To browse our auction, please head to our event site and make sure you're registered if you'd like to place a bid. Tonight, you can also support us through text. Simply text the keyword SRHN Gala 20 to 76278 to sign up. Then text your donation amount to the same number. Every dollar raised makes an impact and allows us to continue our work and extend our reach during a time when the need has never been greater. Please enjoy the evening. And thank you again for joining us tonight.
We'd like to take a moment to thank some of our sponsors this evening: Avenues for Care, The Retreat, and Hazelden Betty Ford Foundation. Thank you so much for your support of our event tonight.
My name is Lori Wilhite, and I'm a board member at the Steve Rummler HOPE Network. I'm a pharmacist at Hennepin Healthcare. I work to improve outcomes in people who are prescribed opioids for pain, as well as help people with opioid use disorders get access to naloxone and treatment for their addiction. For healthcare professionals practicing in the area of addiction and mental health, the COVID-19 pandemic has created a variety of challenges with tragic consequences. Overdoses rose almost 18% across the country in mid-March, and by May, they were up by 42%. Individuals with substance use disorders have been isolated, physically separated from the environment and community that they've learned to recover in, and put under a great deal of stress related to the pandemic. All of these disruptions to routine and emotional stressors can trigger a recurrence of substance use. On top of that, dangerous synthetic opioids like fentanyl are more present in drug supplies now, making overdose fatality a much more likely outcome of use. The work of the Steve Rummler HOPE Network is so critical right now. We are bringing attention to an issue that is still so stigmatized. We are making the opioid overdose antidote naloxone accessible when it can mean the difference between life and death. An individual with an opioid use disorder cannot recover if they do not survive an opioid overdose. From the bottom of my heart, thank you for supporting our work.
Hi, my name is Allie Carey, and I'm the Director of Programs here at the Steve Rummler HOPE Network. Our organization's approach to finding solutions to the opioid crisis has always been multifaceted. Our three main programs are advocacy, prescriber education, and overdose prevention. This year, our primary focus has been in expanding and adapting our overdose prevention program to respond to the demand for naloxone in training, even as this has been complicated by the onset of a global pandemic. We are immensely proud of our Naloxone Access Point program, launched this year in partnership with DHS, which has put us on track to increase the amount of naloxone kits we're able to distribute across Minnesota, and is ensuring that this potentially life-saving medication is more easily accessible for those who need it most. By collaborating with community organizations, pharmacies, clinics, and other businesses, We've been able to establish naloxone access points, or NAPs, as we call them for short, in communities all over the state. Any location with regular business hours can stock naloxone on behalf of the Steve Rummler HOPE Network and serve as a NAP to make it accessible to the public in their area. I just want to say how grateful I am for the incredible partners we've already had for this program. They really stepped up to meet the need in their communities and chose to take on this additional role in a time when things were increasingly chaotic and uncertain for everyone. The work we do wouldn't be possible without their help, and I'm so proud to have them in our network. Another key component of the program is the online training module we've developed, which allows anyone to go to our website, take a compressed online version of our training course, and upon completion, receive a certificate verifying their training. Every naloxone kit we distribute now has a QR code sticker on the outside of the bag, which links directly to this online training option. So essentially, someone can complete the online training in just a matter of minutes, locate their nearest naloxone access point on a map posted on our website, and then walk in to receive a free IM naloxone kit. For obvious reasons, this has been an even more critical tool this year as training options became limited by restrictions on in-person gatherings. Having a remote option was so important for us. SRHN recognizes the exacerbating effect that COVID-19 has had on the opioid overdose crisis. The pandemic has only drawn into starker relief the concurrent issues that face the most vulnerable members of our communities. The opioid crisis has never and is certainly not occurring in a vacuum. Lockdowns, layoffs, and interruptions to critical support services and treatment fuel feelings of stress, anxiety, isolation, and uncertainty, all of which can threaten individuals with a substance use disorder and those at risk of developing one. This is why it has been so important for us to adapt our programs to fit into a largely virtual world and to keep the opioid crisis a part of Minnesota's public health conversation. Our mission has always been critical, but that has never been clearer than it is now. The numbers, quite frankly, are alarming. Preliminary data recently published by MDH shows that drug overdoses in Minnesota had already increased by 20% from 2018 to 2019. And there are indications that substance use and overdose are only on the rise since the COVID-19 pandemic has worsened. Your support helps to ensure that naloxone and proper training are accessible to anyone who might find themselves in a position to save a life.
My name is Almerelli Guerrero Sanchez, and I am the Overdose Prevention Manager of the Steve Rummler HOPE Network. My job is to provide overdose prevention education and naloxone to the public, and this has taken a major shift since the beginning of the pandemic. A lot of support services have had to move virtual in the past months, and we've made that switch as well. The majority of my trainings have been over Zoom since March. I think it's been a great tool in connecting with people from all over the state, and it's encouraging to me how high the volume of training requests continue to be. COVID-19 also required us to modify our training content. We used to train people to administer rescue breaths in addition to naloxone to ensure the overdose victim was getting enough oxygen. Opiates are respiratory depressants, so an opiate overdose is often indicated by shallow or slow breathing and eventually a cardiac arrest caused by the oxygen deprivation. Even with proper use of the breathing barriers that we provide in our kits, our medical advisory committee still feels that the possible risk of disease transmission is too high when giving a rescue breath. So we've modified our recommendation to include chest compressions instead of breaths. COVID-19 also affects the respiratory system and can make breathing more difficult, and that could pose a particular threat for someone taking opiates. These are things we've had to consider. This year is the 5th anniversary of the inception of the Overdose Prevention Program. Even though 2020 has been such a challenging time, we've all come together, and that's been a very powerful thing to be part of. Our amazing volunteer group began assembling kits from home since March, and they're still going strong. We would not have been able to keep up with all of our requests without them. Since our program launched in 2015, we distributed almost 40,000 naloxone kits in the state of Minnesota, and we haven't slowed down at all this year. We can't afford to. Lives are at stake. We need your support.
Now we've come to the most important part of tonight's program. This is where we can make the biggest impact together. We are counting on you to help ensure that we can continue to meet the needs of our communities and face the challenges the next year may bring. In order to sustain our critical programs and services, our goal is to raise $50,000 tonight.
Our Naloxone Access Point program has been made possible through grant support from DHS, but this funding only runs through the end of December. We are committed to maintaining this vital program moving forward. Meeting our $50,000 goal tonight will help to ensure we are able to maintain and expand this program into 2021. These funds will help us to increase our overall naloxone distribution in Minnesota by 20%, extend our reach across the state by establishing naloxone access points in 10 new Minnesota counties, increase our NAP-specific kit distribution to represent 30% of our overall kit distribution, making sure that the kits we provide to our partners are made increasingly available to the public. And finally, to expand our prescriber education program to include educational content for nurses and a wider range of healthcare professions on topics like addiction care and substance use disorder.
Hitting these goals are essential to meeting the needs of Minnesotans, so I invite you to give generously to the Steve Rummler HOPE Network. As you heard earlier, overdose rates have been on the rise all over the nation, so we need your help now more than ever. I'm thrilled to share that the Stiles family has stepped up with a generous gift of $5,000. Thank you so much to the Stiles family for their support and leadership. Who would like to join them with a $5,000 donation? Allie, why don't you share a little bit about what that donation would mean to us?
$5,000 will support and sustain one of our higher volume naloxone access points for a full year. This makes sure they are adequately supplied and stocked with IM naloxone kits, that we provide training for on-site staff to offer administration training as a supplemental service, and that we can provide ongoing support for our partner organizations and for their communities. As a small organization ourselves, we are reliant on these partnerships to make sure that the resources and education we offer can reach as many Minnesotans as possible.
Our next level is $2,500. I'd like to share that we received an anonymous donation for $2,500. Thank you so much for your gift tonight. For $2,500, we can present, film, and produce 2 prescriber education lectures. These lectures are presented to medical students and current prescribers and cover topics such as safe opioid prescribing practices, pain management, and addiction care. As Allie mentioned, we are committed to expanding the scope of this program in 2021 to contain relevant material for additional groups of medical professionals, including nurses, pharmacists, and advanced practice providers. It has become increasingly apparent that a more comprehensive approach to addressing substance use disorder and the opioid crisis is desperately needed across the board for everyone working in the medical fields. Please help us with a donation of $2,500. Moving on to the $1,000 level. Who can join us with a gift of $1,000? How about $500? $500 makes a huge impact. Please give $500 if you can. Or is $250 your lucky number? Please join us at the $250 level. Our last level is $100. We would love to have participation from everybody viewing tonight, so if you can, please give $100.
So if there's an amount you'd like to donate tonight that hasn't been specifically mentioned, please feel free to do so at our event site or by text. Remember to register first using the keyword SRHN Gala 20. We encourage you to continue giving and donating throughout the rest of the program. The auction will remain open until 9 p.m. Thank you so much for your support and your generosity.
Please stay tuned for some messages from the Friends of the Steve Rummler HOPE Network. And later on, we'll be honoring this year's Volunteer of the Year and Champion of Our Cause Award recipients.
Good evening, everyone. We are the Rummlers, Bill and Judy, and we are coming to you tonight from our new home in Durham, New Hampshire. We certainly miss seeing most of you, and even though we realize tonight is a virtual gala, we have not been in the Twin Cities for over a year now, and therefore have seen very few of our good friends and supporters from the Twin Cities. In any event, we are enjoying life out here. We are near our son Jeff and his family, and thinking of you tonight, thanking you all for your support. And at this point, I'd like to turn it over to my lovely bride, Judy.
Thank you. As Bill mentioned, we really miss being there. We had planned to come home to Minnesota for the live gala, and obviously the COVID pandemic changed all of those plans. But we know that with the dedicated staff and new leadership, exciting new leadership, and the support of all of you who have been at this virtual gala, the Steve Rummler HOPE Network is poised to continue its efforts to provide hope for those with chronic pain and addiction. And although the COVID pandemic is a huge public health crisis, I know that the Steve Rummler HOPE Network will continue to try to keep the opioid crisis in the news and make people aware that it is still a huge problem for this country, with over 500,000 people have died from the opioid crisis. So I want to extend my thanks to all of the staff and the board and all of the volunteers and those of you who have participated tonight and supported the Steve Rummler HOPE Network and its very important work that needs to continue in Minnesota and across the country. So thank you for including us remotely, and I hope we will see some of you real soon. Thank you. Bye.
Thank you all, and good night from New Hampshire.
Hi, everybody. It's great to be here for this year's gala. I'm Wendy Brown.
And I'm Keith Brown. We volunteer making overdose recovery kits.
With the pandemic, your support is more important than ever. And next year, we hope we can all celebrate together in person.
Good evening. It's me, Miles Hamlin-Zamoyski, Director at Minnesota Overdose Awareness, bringing you hope from my home here in Minneapolis, Minnesota. Over the years, we've enjoyed many great partnerships with the Rummler Network, and we are looking forward to many great partnerships ahead in the years to come. I hope that this finds all of you well, safe, and happy at home, and have a great evening.
Good evening. I'm Sue Purchase, the Executive Director of Harm Reduction Sisters. We are located in Duluth, Minnesota, and we serve the northeast region of the state, providing mobile syringe services and Narcan distribution to people who are at the highest risk for overdose. And in our work, we are so excited to be partnering with the Rummler Foundation to address the disparities that exist in St. Louis and Carleton County. It's this partnership that will save lives and make a difference in the world for all the people that we love and care about. And I appreciate all of your efforts. Thank you so much. And thank you for all you do, and I hope you have a wonderful evening. Good night.
Hey everybody, Ryan Hampton here.
And Sean O'Donnell.
It is so good to be with you tonight for the Hope from Home event. I wish we could both be there in person. I'd give every single one of you a hug. But since I can't give you a hug, I'm going to give him a hug. And before I give my greeting, just thank you all for letting me get married to Sean. We're going to be getting married very soon. Really excited to be able to do this virtually with you this evening. You know, in these times of social distancing, and I guess it's actually, Randy Anderson would correct me, it's physical distancing. It's important that we keep emotional proximity, and you all are creating that space for us this evening. And I think it goes without saying that now more than ever, the work that you do, the work that each and every one of you are doing around naloxone access and expanding care for people who need help right now, it's now more important than ever. And I can't wait to get back to Minneapolis. I can't wait to see you. Let's keep this movement moving forward.
Well said, Ryan. And it's so good to be coming to you guys virtually. Like Ryan said, I wish so badly I could be there to see all of your faces. We had done so much great work together. So the Steve Rummler HOPE Network, I mean, I hold so dearly to my heart because it was the first organization that I worked for on this issue. After I lost close friends to overdoses and in my own recovery, I wanted to get involved. And I started to do my own research when I was in college and started to realize what a huge issue this is to communities all across the state of Minnesota and frankly all across our country. And I knew that I had to speak up and get involved in some type of capacity. And that's what led me to the Steve Rummler HOPE Network. And you know, over those few years, we had done great work. We had passed some landmark legislation in the state. We had distributed thousands, tens of thousands of doses of naloxone to communities all across our state. And we had brought new education on the topic of substance use disorder and the opioid crisis to emerging prescribers in medical school and practicing prescribers out in the field. And so these three pillars of programming are so incredibly important. As Ryan said, you guys are doing incredible work, and this has been quite a year. I mean, I know that it's been really hard for everybody, for organizations like Steve Rummler HOPE Network, for organizations like ours, to continue to stay connected and reach these communities that need our support now more than ever. And so for those of you who are tuning in, and if you have your checkbooks, I encourage you, please make a charitable contribution to the Steve Rummler HOPE Network. They are literally saving lives every single day in our great state of Minnesota. So I hope to get back home sometime very soon so I can see all of you. And with that, we wish you all well.
And I'll say, to cap it off, like Sean said, if you've got your checkbooks or you can do this on credit card, please give money. The work that the Steve Rummler HOPE Network is doing has become a model for so many other organizations across the country. Some of the work that's being done there, we're looking at how we can duplicate it here in our great state of Nevada. I know there's other states that have taken up your legislative initiatives. Certainly many people asking us on how the network was able to get done what they were able to get done in 2018 and 2019. So thank you for being a model. Thank you for carrying this event forward, even though it has to be virtual. And we will see you soon. And until then, please stay safe, please stay healthy, and we love you all. Thank you.
Love you guys. Bye.
We'd like to thank a few of our sponsors tonight. Marion William Zimmer, New Way, and Alina Health. Thank you for supporting our gala tonight. My name is Alicia Howe, and I am the Communications Manager of the Steve Rummler HOPE Network. One of the more fun parts of my job is I get the privilege of working with our incredible volunteer group. Each year at our annual gala, we present one of our volunteers with our Volunteer of the Year award to recognize their outstanding service and to express our gratitude for all the work that they do for us. This year, we are so excited and honored to be presenting that award to Sally Phillips Helling. When COVID-19 hit, we had to implement restrictions on the type of volunteer activities and gatherings that we were able to conduct, and our staff had to begin working remotely. And this really put us in a stressful situation in terms of our naloxone kit assembly. Up until March, we had volunteers coming in every Wednesday to our office to assemble naloxone kits, and Sally was one of those volunteers. And we were really stressed out just thinking about if we were going to be able to meet the demands of continuing to have all of the kits that we needed. And Sally was one of our volunteers that stepped up and said, I want to keep assembling kits at home. And that really saved us. What I appreciate the most about Sally is what a positive energy she is. She always has a positive attitude, and she always has a smile on her face. And that is just so important when the work that we do can sometimes be so heavy. She's a great listener, and she always makes everybody feel so valued. And I am so excited and honored tonight to be presenting her with our Volunteer of the Year award.
Thank you, Alicia. You're way too kind. I'm here because of Casey Jo Schulte. Her mother, Shelley, is my cousin, and we all grew up in western Minnesota, really more as siblings. Like so many of you, our family has been profoundly affected by this epidemic. Shelley will talk more about that later in the program. I attended the first fundraiser that was held to create a scholarship in memory of Casey Jo. And there I met Randy Anderson, who at that time was the overdose prevention manager for the organization. I expressed some interest in volunteering, and he referred me to Wendy Brown. And as all of you who know her, will agree. Wendy's commitment to the cause and her enthusiasm are legendary. And that's how I began working with the Wednesday morning kit assembly team. As so often happens, and did with me, the volunteer can benefit as much as the organization. I've learned so much about substance use disorder and the greed and the insidious tactics of Big Pharma in perpetuating it. And I've also learned about the vital and tireless work of the Steve Rummler HOPE Network. Although our team members change from time to time, each one cares deeply about this issue. Some have experienced substance use disorder. Sadly, way too many have lost a child or other loved ones to it. Some have saved their own child, a friend, or even a stranger by using naloxone. On behalf of the entire team, I want to thank the staff for always making sure we have the supplies we need to make our kits, and especially for your creative problem solving and finding ways for us to continue our work during the pandemic. The need has never been more crucial. Finally, I can assure you there's no greater reward for any of us than to learn that one of our kits has saved a life. And there's now one more person who is alive and has the hope and the opportunity to recover. Thank you all so very much for your generous support.
Hi, my name is Shelley Elkington. I want to thank everybody for attending our virtual gala this year. I've attended the last several galas and I really miss everybody. It was the one time a year we could all get together, see each other after a year of advocacy and volunteering and just hard work. So next year we'll get together. I am a board member with the Steve Rummler HOPE Network. I've been a part of this great organization for the past several years. Last year, I was honored to be presented with the Senator Chris Eaton Champion of Our Cause Award. This award is given each year to recognize the outstanding work done in support of the Steve Rummler HOPE Network and our mission here. You know, we're not just a board, we're not just staff, we're not just volunteers. We truly are a network of change makers and advocates who daily work to fulfill our mission here and to make an impact and to fight to save lives. This year, I am honored to present the 2020 Senator Chris Eaton Champion of Our Cause Award to two people, Dr. Pete Stiles and Stephanie Stiles. As a pain management physician, Dr. Pete Stiles is an incredible advocate for patients with both acute and chronic pain concerns. During his 5 years on our board, he has served terms as both vice chair and board secretary, and let me tell you, that's no small task. Dr. Stiles has dedicated his time, his leadership, and his incredible planning skills to help us create and maintain a solid organization and a solid foundation. He was also a leader in our Prescriber Education program. Pete has provided lectures on comprehensive and interdisciplinary pain management, as well as alternative pain management strategies. His expertise has been invaluable to us. Pete was also a tremendous asset to the network because he brought along his wife, Stephanie. Stephanie Stiles has impacted our success immensely. She has volunteered for the Steve Rummler HOPE Network as a member of our development and gala committees. In 2018, Stephanie was chair of our 2018 gala and was a leader for our 2019 gala last year. This is our largest fundraiser that takes an incredible amount of organization and planning skills. The good work that the Steve Rummler HOPE Network does in overdose prevention, advocacy, and prescriber education would not be possible without the thoughtful and dedicated time devoted to the development committee. These are often thankless jobs, and Stephanie took them on and provided the insight to help make our program successful over the years. Thank you, Pete and Stephanie. Your contribution to the Steve Rummler HOPE Network have allowed us to provide life-saving services to our communities. We are incredibly grateful to both. Again, it is my honor to introduce to you our 2020 Senator Chris Eaton Champion of Our Cause Award recipients, Dr. Pete Stiles and Stephanie Stiles. Thank you guys for everything.
Thank you, Shelley. Our sincere gratitude for this recognition and honor. It's been a pleasure serving on the board, working with staff, and supporting the network. There are few organizations of which I'm aware that so directly and positively impact such a breadth of our community. Through my association with the network, I've lectured physicians and nurses, I've advocated with organized medicine groups, and I've distributed naloxone kits to patients and concerned family members. Let me say that again. I'm a pain management physician, and at times, the only way to get naloxone in the hands of my patients was through the work of the Steve Rummler HOPE Network. The work that you support through the network is truly life-saving. I want to thank the board with whom I have served, the staff with whom I have worked, and my family, parents, in-laws, children, and wife, for allowing my time away. I also want to thank my wife Stephanie for her expertise that she provided with the establishment of this gala celebration many years ago.
We are honored and so proud to be associated with this organization. My sincere gratitude to those with whom I worked on past galas, who are spending countless hours to bring awareness and support to the Steve Rummler HOPE Network. My thanks to my family too, of course, for supporting our efforts. With COVID-19 upending lives while limiting access to addiction care and support groups, there has never been a more important time for the work of the Steve Rummler HOPE Network. We believe in the impact of the important community resources that it provides. Every dollar raised tonight will improve the continuum of care surrounding opioid disorder. We encourage everyone attending the virtual gala to join us in supporting the Steve Rummler HOPE Network.
Thank you for this recognition, and thank you for your support.
Hello everyone, I'm Molly Booten and I am the Director of Creative Services at the Steve Rummler HOPE Network. I am so excited that you have joined us this evening and look forward to the day that we can be together again. I have been with the Steve Rummler HOPE Network since the beginning. I started out as a volunteer and then became the first official employee. I have learned so much over the years and have met many amazing people through this journey. I'm grateful for the opportunity I have been given to help raise awareness of the opioid epidemic. It is my greatest wish that we are making a difference. So with that, I just want to say thank you one more time to everyone who has supported us over the years, and especially tonight. I am very excited for what is to come next. Some of you may know that Steve was a talented musician. Have you ever noticed that the symbol in our logo is made up of 2 drumsticks? That is because Steve was a drummer. He played for many years in an awesome Minneapolis band called the Goonie Birds. These guys were Steve's best friends, his second family, and we are so lucky that Bump, Chris, Pito, and Mark are able to join us tonight. So get up off your couches, turn up the volume, and get your dancing shoes on. We have a very special performance just for you from Steve's band, his second family, and my good friends, the Goonie Birds. Take it away, boys.
Thank you, Molly, for that great introduction. Mark Collins, Chris Ryder with the Goonie Birds.
Hey!
We are here at Steve's Tree. We just want to say it's great to be here, part of the virtual gala.
Yes, thanks, Molly. Hey, we're hoping post-COVID to see you guys all in person, but we wanted to say hello from all the Goonies, and remember to give to the Steve Rummler HOPE Network if you haven't already.
Donate, donate, donate.
chopper. Brother Pito.
Shake it, shake it, baby. Shake it, shake it, baby. Shake it morning, shake it afternoon. Break out in the sunshine, could we make a little shake it? Shake it up, baby, don't you wait. We've got no time to hesitate. Shake it, shake it, baby. Shake it, shake it, baby. Just a fool fell for you. Shake it. Thank you.